Most remote and rural communities in the Eastern Cape are said to be a thing of the past. The province has handed over a total of 85 mobile clinics to all its districts, with many of them going to rural areas to improve its health services. It's service delivery literally on wheels. A total of 85 mobile clinics destined for some of the province's most remote and rural areas. The rural community of Mooiplaas outside East London is one of the beneficiaries. Authorities say the mobile clinics are an answer to rural communities battling with no primary health care facilities. And now our reporter Unati Bingose is there, and he now joins us on the line for more. Unati, good afternoon. Nice to chat to you once again. A total of 85 mobile clinics being delivered today. Can you tell us exactly what prompted this initiative?
Well, I suppose largely it's because Eastern Cape is a very, very rural area, and it's difficult to access some of the villages here, and they have a clinic in each one of them. So these mobile clinics are coming very, very handy in that part, and that they are able to be driven to those villages that do not necessarily have clinics, and make sure that even people of those villages are able to get these much-needed primary health care services. So those that need chronic medications, like those who are diabetic and those who are suffering from sugar diabetes, those who normally have to travel long distances almost on monthly basis to get their medication, and of course those who are suffering from diseases like HIV and AIDS and things like that, they are able to have those services literally on their doorstep. So it has come in very, very handy, particularly for those villages that are far-flung with very, very limited resources and amenities.
Now, Unati, we can still see the pictures there from Mooiplaas near East London. That's where you were and witnessed that handover. Just what was the response from the community?
Well, community members wasted no time. They say that this is the kind of service that they have been hoping for all this time. I mean, young people, elderly people, mothers of young children were there to take full advantage of the service, because it's something they say that they've always had to walk or drive long distances to access. So having it at their doorstep was just the necessary thing that they needed at that particular time, and they made sure that they took full advantage of it. And I can tell you that they were very, very excited to have the service coming to them. And of course, this was just a formal handover of these mobile clinics. The actual fact is that they've been up and operational for quite some time now. I remember we met a mother of a 5-month-old child, and he says that prenatal tests were done in those mobile clinics, and now that her child is born, the postnatals are also, she's also doing them at the very same clinic. So she says they are coming in very handy. They're not only saving her time and money, but they're making trips to the clinic even very, very easy, even for her child. So these are very, very welcome. This is a very welcome relief for those rural communities. But of course, in order for this thing to be successful, I mean, other departments will need to come on board. I mean, there is still an issue of accessibility for these vans to access certain rural areas where roads are in a very, very poor state. And they're speaking to the health department. They say that they are currently in talks with the roads department to ensure that the roads are made available. They do build roads so that they can reach even more areas, because in certain villages they have to stop on top of the hill and allow people to walk up to the hill so that they can access these services. And another thing they say they will need the most are nurses who are going to operate these mobile clinics. So they are state of the art. They have just about everything you may need from and you may get from an ordinary clinic.
And talking of exactly that, Unati, very quickly, the state of the roads and other related facilities, does this delivery then really change the level of health delivery in the Eastern Cape province?
Well, there's no denying of its impact. I mean, Mooiplaas, for instance, where we were, I mean, roads are there, but it's been a question of having to travel long distances for some of the patients to access the primary health care services, which means a lot of them to default on taking their medication. So in those rural areas where they use accessibility in terms of roads, it is making a difference. And of course, even in those areas that currently do not have up to standard kind of roads, they're able to drive as close as possible and allow people to come over and access these healthcare services. But of course, in certain areas, the issue of roads is of paramount importance. It's something that the roads department will have to step in and rectify in order for these services to be able to access those people also.
All right, thank you so much. That was our reporter there, Unathi Bingqose, speaking to us live from East London in the Eastern Cape province. And in other news now, lack of security and intimidation are threatening the civil court sheriffs from doing their job of dispensing justice in the